Now, you are welcome to Health is Health, a Precious Access. To handle the program is a medical expert, an optician, an eye doctor. Your name, Doc?
Dr. Mrs. Chinwe Clara Ifeanyichukwu.
Dr. Mrs. Chinwe Clara Ifeanyichukwu is the medical director, Shepherd Eye Clinic, Afor Ogbe, in Ahiazu Mbaise local government, Imo State, Nigeria. Today, we'll be dwelling on harmful eye medication. Doc, what is eye?
The eye is a vital organ in the body that helps us to see, that helps us to appreciate things God created in the universe.
It is being said in some parlance that eye is vision.
Yeah.
Can you expatiate further?
Yeah, eye is vision. In the sense that you will use it to see so many things and good things around you. It is said, even from the Bible, that if your eye is dark, the entire body is dark. The eye is the window to the body. You use it to see, you use it to perceive. You use the eye to appreciate what God made. Thank you.
So without the eye, there is no vision.
There is no vision.
Now, but there has been scenarios where this eye is being affected, possibly due to accident, possibly due to illness, and other harmful effects. So, what are some of those problems, those ailments that can make the eye not to function properly or see as it used to be?
Yeah, there are so many things that can affect the eye. That will make you not to see or even cause one to go blind. Take it simply. Even when one will have something, this one we used to call Apollo. Apollo, we call it acute hemorrhagic conjunctivitis. It causes redness in the eye. So whatever that causes redness, inflammation to the eye, will reduce one's vision, the ability to see well. So if it's not arrested on time, it may lead to blindness. So many things can lead to blindness. That one, even measles, even accident. If you have injury in that black side of the eye, we call it the cornea. Behind it is the iris. The iris gives the eye the color it bears. So when you have an injury at that cornea, if it's not arrested within 7 days, blindness is setting in. So many things can cause the eye not to see well. That's why if you have any form of problem, any kind of disturbance in the eye, do not just wait. Meet your medical practitioner to take care of you on time. Thank you.
Now, even at times, the dogs, the sand,
yes,
and other speaks from flying objects, wood or whatever. can enter the eyes, and in such situation at times can be harmful. So what is the best way to handle such situation?
When one has any form of trouble with the eye, any form of unpleasant encounter with the eye, the best thing is just for you to meet a medical practitioner, an eye doctor, optometrist, ophthalmologist. I am an optometrist. They will take care of you properly. Don't just go to the pharmacy or the roadside stores to buy medicine on your own. You may not know whether that you are using may be endangering or adding more to the problem you are already having. So if you have any form of problems, anything whatsoever that is that may be affecting your eye, go straight to an eye doctor. They will take care of it, they will examine it and know the best drug, the best thing they will apply as to arrest the eye, the problem at time.
Doc, what are some of the eye diseases? How many eye diseases, and what are some of these eye diseases?
We have so many eye diseases, from bacterial infections to fungal infections to viral infections to even as a result of accidents, even that may come from the body, because eye is the window of the body. Whatever that happens to any part of the body is made manifest in the eye. So you have so many diseases of the eye. So call it conjunctivitis, like you say, if someone may have malaria, it may come or manifest in form of headache. In the eye, you have a kind of redness of the eye, we call it conjunctivitis. When you see such a situation, it is not only just mere redness of the eye. You probe more. It might be that the pressure of the eye is high, or that something may have entered the eye, or you have a kind of foreign body in the eye that leads to that, or a kind of viral infection or bacterial infection that may cause that to be. So the redness is as a reaction of that is wrong with the eye. So there are so many diseases. Like the Apollo I called is a viral infection. Some people call it bacterial. It's a viral infection. When your immune system becomes so low, then you see the eyes, it will be itching and kind of discomfort. When you try to put a dirty hand in the eye, in a reaction to curb the itch, you introduce the bacteria, and before you know it, you have a kind of pus coming out from the eye. In that bit, you will say, I have bacterial infection. At the end of it, though, someone may go up and buy chloramphenicol eye drop and that. Yes, it may help, but the main thing is not that. There is a cause to that one, which is the viral infection. When you take care of your immune system, when you boost it up, whether you take bacteria, antibiotics or not, on its own it will subside. So here we treat the cause, the root cause of every problem, so as for you to get the result of what you want. You also have glaucoma. Glaucoma sometimes is as a result of high pressure in the body. When the pressure of the body becomes so high, it affects the eye, and the eye will start, the pressure of the eye will also go up. When it goes up, sometimes it manifests in form of redness, or somebody may come in and say, I'm not seeing very well. When you do your proper examination, at the end of it all, you see that the pressure of the eye may be so high. Though the pressure may be high, yet it is not that you try to find out the cause of the hike in pressure. Maybe the person may have that BP, high blood pressure, or may have cholesterol high, or diabetics. Anything can lead to that pressure, or the person may have a kind of heat in the eye. It may be in the time past, then it will now result to hike in pressure. So many things can cause troubles in the eye. Okay, another one is someone may have a refractive error. You may be straining to see. This one may be an inborn, or you may just encounter a kind of serious situation in the school that you need to read very well. When you use that eye in an intensive way, you may sustain a kind of pain. That also may increase the pressure in the eye. So when you find out where the problem may be coming from, then tackling it, the pressure will come down and everything will be okay. So there are so many problems in the eye, and they are hydra-headed. If you are not careful, you may miss this for that. Thank you.
Is cataract the same as glaucoma?
No. Cataract is different from glaucoma. Cataract is opacity of the lens in the eye. It's different from glaucoma. Why glaucoma is a high pressure of the eye. Yeah.
So can you expatiate on cataract?
Well, cataract, as I said, cataract is the opacity of the lens. It can be caused by hereditary. Maybe you may have the chief cause of it is diabetes. It may be hereditary, yes. It may be as a result of untreated heat or a kind of heat in the eye. It may result to cataract. So when it comes, it may be coming and you will not be seeing very well. With time, it will be maturing and maturing till the time you will not see again. But that one is fairer in the sense that at the end of it all, the solution to it is just surgery. You remove the opacified lens and put artificial lens for the patient to see. Thank you.
I want to thank you so much, Augustina Amade, Victor Mosisi, and all those watching. If you are just joining us, we are on to health, a precious asset. And handling the program today is Dr. Mrs. Chinwe Clara Ifeanyichukwu, the medical director, Shepherd Eye Medical Clinic, Afor Ogbe, in Ahiazu Mbaise, Imo State, Nigeria. Doc, in eye care, a lot of people they go to the chemist, and ask for all kind of mixture of drugs. They even take ruse and all kind of mixtures and concoction in order to handle eye problem. What is your advice on this?
Why all this happen is because I call it ignorance and the state of the nation. In an organized environment, such is not allowed. Medically, it is not fit. Because I've encountered so many patients who may have gone to the chemist, gone to the roadsides, stores, and they have used herb or concoctions to treat their ailment. At the end of it all, if it's not arrested on time, it leads to blindness, or it may condemn or disfigure the size of the eye. It is not good. When you have a problem, the eye is a vital organ of the eye. When you have a problem, meet the experts who know it, who can take care of it. So you don't just go to the pharmacy stores to buy drugs. You are not a medical doctor, and you may not have even read about it. So there is no need for you to go and have a personal self-medication on any problem that that may be affecting your eye, you need to meet an expert, meet an ophthalmologist, meet an optometrist to take care of your eye. Thank you.
Eye is a vital organ of the body, and eye is vision. When the vision is lost, there is blindness. In this situation, Doc, what is blindness?
Blindness is an inability of the eye to perceive the light, to perceive things the way you ought to see. You will see it as, we call it total blackout. That is blindness. In a literary sense, it's just a total blackout. That is blindness. Medically, we call it a state where one is unable to see or perceive objects around the person's environment. So that is blindness.
So when the situation like this results, is there a duplicate?
It all depends on what may have led to the blindness. In a situation like this, if it's total blindness, it is total, and nothing will be, there will not be any form of remedy to restore the eye again. But if it's something that you can, say it's not that total, but it's bad, you can just arrest, let me say, 20% of it. But when it has come to blindness, total blindness is gone and is gone forever.
So total blindness is incurable.
Yes.
Now, is there, when we come to dietary, is there things that one should eat or ascend from, or drink or ascend from, that can help or mar the eye?
Yes. One can be taking red foods. Red foods are good. They contain retinol. This retinol, there are flavonoids that are being used in the eye for one to see well. You can see food, the red foods like you see carrots, watermelon, even this odara that is ongoing now. All these red foods are good to the eye for you to see well. It's also good for you to be taking lots of water, to be taking away radicals, because the sun also affects the eye. So when you take a lot of water, it helps to dislodge all these free radicals that may affect the one vision. So water is needed too. Good foods are not fast food and alcohols and all these confectionaries. No, they are not rich. We need to be taking balanced diet to maintain the vision of the eye.
When you were outlining some of the eye diseases, you also have on some of the diseases that also induce this eye problem, like diabetes and others. How do diabetes affect the eye?
Diabetes is as a result of undigested glucose. So it's looking for where they will be deposited. As it's not been assimilated in the cells, so they will be looking for where they will be deposited. And when they deposit in the cells or organs or tissues in the body, they will cause harm to that part of the body. Now, if one is diabetic and salt is deposited in the lens of the eye, then we now say that the person has cataract. And in a situation like this, where one is diabetic and cataract is there, the degree in both eyes are the same, compared to when one may have a kind of heat in the eye in the time past that may lead to cataract. In that one, you may have it in one eye, and the other may be free. So in the case of diabetes, the two eyes will be involved, because it's a thing that it comes from the body. So where is the undigested glucose is deposited, it causes trouble. Yeah.
So does high blood pressure also affect the eye?
Yes. High blood pressure do affect the eye, seriously. It can lead to high in pressure, leading to glaucoma. And if it's not arrested on time, one will go blind. Yeah. It can also cause the bulging of the eye. Yeah. It may also lead to refractive error if it's not taken care of on time. Yeah.
So what is the advice to patients done with these ailments?
What I advise to people is take your health seriously. Whenever you have or notice any kind of disturbance or a kind of shift in your health, try and find out exactly what it may be and go to the experts, those that studied it, those that are in it, to take care of you properly. At that, you may not even spend more money. They'll just give you one or two advice or one or two things to do, and you'll be well. Instead of you doing self-medication, at the end of it, or you will still go back to that expert, then the chances of getting your health may be difficult, and you spending more money, at the end of it, or you'll be noted. Your name will now be that ailment you are passing through. So it's not good. So everyone should take one's health seriously.
So self-medication can cause the loss of the eye, the loss of vision.
Yes.
Now, if you are just joining us, we are on to health, a precious asset, with Dr. Mrs. Chinwe Clara Ifeanyichukwu of the Shepherd Eye Medical Clinic, Afor Ogbe, in Ahiazu Mbaise local government in State, Nigeria. Dr. Chinwe Ifeanyichukwu. Some people, for the sake of maybe fashion or other things, most of the time they obtain glasses on their own, sunshades and things like that, to shed the sun. Even during conjunctivitis, infection of conjunctivitis, they put on glasses, and others who they are having problem with reading and seeing, they go and buy glasses on their own without consulting medical experts. What is your advice to this kind of people, and what can be done to stop this kind of trend?
Well, glasses. One needs to meet an expert to protect one's eye. If you have any form of, even though you may need sunshade. The problem of the eye is not 100% glasses. Just like I explained, it's not 100% glasses. There might be an element behind that may be eating up the eye without you knowing, and at the end of it, or you will say, I have problem. You buy sunshade from the wayside seller, or you just go to the market and buy. No, you need to meet an expert to cross-check the eye very well. Then if it's a sunshade, yes, the sun is too intense. It affects the eye so badly. Then there are lenses that suits the situation you want. Who give it to you? Then if it comes to reading, yes, when one is coming up in age, we need to use glasses to see well. We call it presbyopia. At that stage, you need not to even go to the market to buy, because you may not know whether you have problem, how far or near. You just go and buy. is when you come to a medical practitioner, they will examine you well and know the one that will suit you before you start wearing. Even when some people may have gone to do that, at the end of it all, they will introduce or induce glaucoma, high impression in your eyes. So I don't know what I will name that. Is it economy or financial state? I may not know, but chiefly I call it ignorance, because the earlier one knows that whatever problem you have in the eye, you meet an expert, I think the better. Thank you.
Dr. Chinwe Clara Ifeanyichukwu, I want to thank you so much. But before we go, for those who borrow eyeglasses, Yatum Kamtidi, Kamwere Garehe, Yatum Kamtidi, Kamwere Guapo. Give me. I want to put it on to go to somewhere. I want to use it to read. What is your best advice to them?
Well, it's not
the case of that person who has a medicated eyeglass, is it likely to be same with the borrower?
Yeah, it's not advisable for one to be borrowing glasses to see. Once no one's problems, no two persons may not have the same problem. It's very, very rare for two persons to have same problem. Yes, one may need a correction afar, and the other may not need a correction afar. At the end of it, they both need glasses to read at near. So when you borrow, when the one that may not need correction afar borrows from the one that needs correction afar, you are introducing pressure to the eye. After using that glasses, your eye, you may not see well for a while, or you may have a kind of headache, a kind of pains or sharp pains in the eye, which is not advisable. There are also infections that you may get as a result of wearing another person's glasses. So all those is not advised. Even eye drops is not even advisable for you to use anybody's thing as long as the eye is concerned. Glasses, eye drops, no. It's yours and yours forever. Even though the person may be your husband or your children, you need to have your own, and your husband should have his own.
Is there a kind of work that somebody will be doing that could affect the eye?
Yes. Like these people that used to do this commercial that puts food in a commercial way, that sells food at the wayside. Definitely, in order to, because of the economy we find ourselves, they use firewood. Every day, the smoke from the firewood enters the eye in the bid for them to cook and sell and get some money. That smoke is not good. So that kind of, in such a situation, they need to meet an expert for an advice so that that smoke will not disturb them. To some people we may have seen, later in life they develop glaucoma and other dysfunctions and other so many things, complications in the eye. So it's very, very necessary. If you want to embark in such a business, you need to meet an expert. What do I do in a situation like this? They will tell you, so that not when one will be aging, you face a glaucoma or any other complication that may cause the eye to go blind. Likewise, when someone, an albino needs glasses, shades to protect the eye, to help them to see well. Even though you have a problem, you need to meet your expert, meet the eye expert to tell you the kind of glasses, the kind of lens you ought to use that may not affect you later in life. Thank you.
For those who do wedding works, what are some of the harmful effects of the wedding works?
Yeah, even the welders, they too need their goggles because the chips from what they are welding may enter the eye. That is, it may be, that's the foreign body in the eye. It may even enter right inside depending on the frequency of the entrance. So when it gets there, it may lead to blindness. So they need a kind of protection whenever they are doing their welding, so that their eyes will be protected.
So what is the kind of protection specifically for them?
Yes, they need a goggle that will cover the eye very well. Cover the side, cover cover the side, cover the upper part of the eye, so that there will never be any space or entrance for the chips to go. Even the light they are using for the welding, we call it magnesium oxide, is not good. So with that shade, it protects them from the rays from affecting the eyes. They need a special lens to do such. So when you go to the market, you see a kind of white. They don't need a kind of white goggle or shirt. They need a kind of special lens that will protect that eye from the rays and as well as the chips they are filing. Thank you.
The medical director, Shepherd Eye Clinic, Dr. Chinwe Clara Ifeanyichukwu. In some cases, in some scenarios, this eye infection, there has been cases it becomes malignant and cancerous. What can lead to this, and how can it be best addressed?
Earlier detection and treatment is always the key to arresting situations in the eye. Not when you leave it, it becomes so malignant or chronic, where it becomes so difficult for it to be treated, that it comes to a stage of management that some patients will come up to meet the doctor. That is a problem with Africa. We have such a mentality as to say, I can do it myself. But when we meet an expert, when you notice a little disparity in the way you ought to see or do things, it helps and it goes a long way to solve the problem permanently. But when we leave it in a stage, in a chronic stage, in a malignant stage, where it becomes, it comes to a stage of management, chances of getting that eye or whatever you want to get becomes so slimy. So please, it's not good for us to wait. Whenever you notice any form of disparity, meet the expert in that area.
We have noticed situations where people, they advertise, they even say they do eye surgery and things like that, but they are not operations, they are not eye specialists. What is your best advice to patients that are having eye problem in this situation, especially for those who do this eye surgery?
Well, I will advise patients to, before you allow yourself to be examined by anyone who calls himself or herself a doctor, first of all, Nigeria is very porous. Anyone can come up to answer one thing or the other. There is no security to all this. So before you allow yourself to be examined or go to any place for, you first of all ask. Then another thing is that the doctor ought to have a permanent place to stay, not those that move about. When they move about to treat people, at the end of it all, when they may have made a mistake in taking care of one's eye, where do you go and look for them? You may not see them. Even those from outside the country, they call themselves from Senegal, from they used to come here and do eye surgery. And when they leave for their countries, where do you search them? After they must have damaged the eyes. So it's not really good for you to surrender yourself to anyone you see that calls himself or herself a medical doctor. Know truly where the person comes from, where the clinic is, where the person ought to have a permanent place where you ought to go and visit them, and not the mobile ones. Thank you.
Before we round up this program, do you have other remarks to make, Dr. Chinwe Clara Ifeanyichukwu?
What I will advise the patients to do concerning your eye, first of all, take care of your eye on your own. Observe the water therapy, eat fruits, eat balanced diet.
That's water therapy.
Yes, water therapy.
Taking a lot of water.
Taking a lot of water in the morning.
Like how many?
In the morning, you take the big ever water. You take it at once in the morning. Then when you urinate, you take a little cup, drink. Take a little cup and drink water again to fill it back to your system. So with that, you'll be urinating and also filling it back, and it will be helping to wipe off, clean off every dirt and every form of radicals that are not needed in the body that may go and attack itself on any part of the body and start causing trouble. So my advice is take a lot of water, take fruit, eat balanced diet. Though the economy is so harsh, but try as much as you can to eat healthy foods. Then number two, if you notice any form of trouble, disparity in your vision, do not hesitate to meet an expert. They will direct you on what to do at a subsidized rate. But when you start taking a self-medication, this may be costly, that, when it becomes chronic or a state where you can no longer handle, then that your fear comes in. Then you will now pay extra to take care of the eye. Maybe at the long run, that eye may be lost. Then thirdly, I will advise the government to look into the porosity of the country, where some people may come in and pose themselves as doctors, as this, as that, as to cause trouble in the country. They ought to be licensed, or they ought to have a permanent place where they stay, so that if there is any problem or anything they may have caused to any patient, they will be located and things will sort itself out. Thank you.
On this note, I want to thank you so much, Dr. Chinwe Clara Ifeanyichukwu. The eye is a vital organ of the body. The eye is the vision. Any damage to the eye will cause you total damage, total darkness of the body and the environment. And on this note, I want to thank you so much. I also want to thank those watching, Amade, Wosisi, and others, all of you that are watching, wherever you are watching from. We keep on bringing you updates on sports, on culture, on religion, on medicine, and what have you. Remain beautifully blessed until we meet again. Thank you so much.